Hi guys, and welcome to Clinical Practicum for Spring 2021. I'm Melissa Carter. I'll be one of your clinical supervisors for the semester. I wanted to go ahead and make this video so that we can go over as a group some of the clinic policies, procedures, and paperwork, and that way when I meet with you individually this week we can just discuss your individual client. So a little bit about me. My husband and I are from North Carolina. I did my undergraduate work at University of North Carolina at Chapel Hill, my graduate school at East Carolina University. That's where I met my husband. My husband is Dr. Carter. He is part of the teaching faculty here in the department as well. My clinical background, prior to coming to VSU, I worked in a ear, nose, and throat or ENT setting. So I did a lot of adult voice, swallowing, and head and neck cancer patients care. I really enjoy that. Here in the clinic we see a little bit of everything. I even take a group of you with Miss Mullis over to one of the local private schools, Crossroads, where we provide speech and language therapy services. My second full-time job is the picture in the bottom left. Brooks is our oldest. He is in middle school. Kennedy is 8 and she's in 3rd grade. We have Gabe in 1st grade, Graham in pre-K, and our babies are twins and they are 2. And I look forward to getting to know you all at your individual meetings this week. I've included my contact info on this slide in case you all need to reach me. My email address is melcarter@valdosta.edu. Make sure that you have that saved in your contacts. There is another Melissa Carter on campus, but mine is the Mel Carter one. My office is 2121. I have my cell phone number there too. Go ahead and add that to your contacts, and that way if I have you on teletherapy and we have any technical difficulties, we can text real quick, or if you're heading to Crossroads and you have car problems or you're running late or anything like that, that we can contact each other. And if you don't mind sharing your contact and sending me your cell phone number, that would be great. Office hours, I'm busy in clinic, however I will make time to meet with you anytime that you would like to meet throughout the semester. We can set up a Zoom meeting or meet here face-to-face with social distancing. And Ms. Cole, I think, has already sent this out to you, but this is the clinic calendar for this semester. You can see that this week is the clinic pre-planning. Our first day of clinic is going to be the 19th or the 20th. The 19th for Monday, the 19th for Tuesday, Thursday clients, the 20th for Monday, Wednesday clients. And then you'll see midterms, progress reports. We will go over progress reports and I'll send out samples as that day gets closer. You'll also see the paragraph in the beginning with COVID precautions. They took spring break away this semester, however they dispersed it with some random days throughout the semester that we have off. And so Ms. Cole put a little paragraph up there saying that you have the option of continuing with therapy those days or canceling. There's no penalty for doing that. You just need to let us know in advance. So once you've had a chance to look through your client's chart, I'd like you to go ahead and call your patient or the client's parent if it is a pediatric client. Remind them of the therapy days and times. Make sure that they still work those times and days. If they don't, please let me know as soon as possible so that we can reschedule. Make sure that they have your cell phone number and your email address in case they need to contact you throughout the semester. If it's a pediatric client, you can ask the parent what types of things the child is currently into, and that will help you when you're coming up with therapy activities or prizes for your prize box. Remind the clients, if you have a client that will be doing teletherapy, please remind them that we'll be using Zoom again this semester and that I will send out Zoom meeting invites that they will use for each session. Also, remind them about the COVID clinic policies for those that are face-to-face, that they should bring their mask and that our clinicians and supervisors will also be wearing masks. Once you've had a chance to go down to the file room in the clinic and grab your client's chart, please fill out one of these new client protocol sheets. You can find this in Appendix P of your clinic handbook. There's also some printed out copies in the drawers in the filing cabinet to your right when you walk in the workroom. This just helps you go through a chart review. This is not graded. Again, helping you just to get the important information from the chart. Documentation guidelines. So if you have a Monday, Wednesday client, your paperwork, which means your SOAP notes and your lesson plans, will be due to me by noon on Thursdays. And if you have a Tuesday, Thursday client, your paperwork will be due by noon on Friday. I do everything in Word, and over email. So you will write those up in a Word document and send them to me as an attachment. And I will use track changes in Word, make revisions within the document, and send it back to you. It's important that you open and download the document, not just preview it in your email, in order to see my revisions come up in a different color. You don't have to then make those revisions and send it back again. That's just for you for learning and applying to the next week's paperwork. And then progress reports are due at the end of the semester. Again, as that time gets closer, I'll send out samples and talk to you a little bit more about that. So your weekly SOAP notes is your documentation in which you type up the results from your sessions for the week. And I have a template that I made for pediatric clients. That's your pediatric SOAP note template. And then I also have one for adults, the adult SOAP note template. So this is the pediatric one. It has some drop-down menus and text boxes here where you fill out the information. The subjective section, this is just a brief 1 to 3 sentences where you type any symptoms that the client might have experienced, or anything that might have affected their performance during the session, whether it's their attention or they weren't feeling well or anything like that. The objective section is where you will put all your data, and you'll do one of these for the week. So the goals that we come up with together will be listed here. And then if it's a Monday, Wednesday client, you'll choose Monday and Wednesday from the pull-down menus, or Tuesday, Thursday for Tuesday, Thursday clients. You'll put your percentages for the goals in those columns. And then if the goal is not met, you'll put continue goal. But if it's met, you'll put goal met. And then you have the assessment section here. And this is more of a paragraph where you're doing a brief summary of performance and the current level of functioning. You want to compare performance from one session to the previous session. Are they making progress? What types of strategies and cueing helped? Things like that. It's not going to be a play-by-play where you list every single thing that happened during the session. It's more of a overview summary. The plan section is you just choose from the pull-down menu to continue treatment. If they're ready for discharge, they've met all their goals, you would choose that option as well. And then patient caregiver counseling and education. That's an important part of our job as speech-language pathologists, to provide counseling to the patient or their family members and caregivers. And so I have some options in this pull-down menu that I want you to choose from, given whatever education or homework assignments you provided. And the adult SOAP note template looks pretty similar. The only thing that's different that you would see in a typical adult setting, like a skilled nursing facility or hospital or outpatient setting, some like activity tolerance, level of alertness, pain score. And so there's just little, again, drop-down menu boxes there. You'll have your long-term goal and then for the semester, and then each short-term goal listed here with the percentage for the week. Other than that, it looks pretty similar to the pediatric SOAP note. From there, we'll discuss the lesson plans. It's 3 sections. The first one is the goals, and the lesson plan you're writing for the week that's coming up. You're planning for the next week. The SOAP note you're writing on what happened during that current week. So the first section is the goals and objectives, where that section will mostly be the same each week. You're listing out the goals for the semester. The next section is methods, and they're numbered, and the numbers should correspond. So method 1 tells me how you're targeting goal number 1. But the things that I'm looking for in this methods section is, I kind of listed them here. I'm looking for the skilled intervention that you use, so what approach you used to treat that particular goal, the client's role in the procedure, how are they responding, the specific error strategies that you use. So the client gets the response, or they respond incorrectly. What type of cueing or what type of strategy are you going to provide to help them at the correct answer? And then last on there, number 4, it says the type and schedule of reinforcement. So how often are you going to give them reinforcement, and what type of reinforcement? Is it verbal reinforcement, high fives, things like that. And the last section of the lesson plan is the materials, and that's just, I don't necessarily look at that. That's more so for you to stay organized for your sessions for the week, but just everything that you'll need for your session. So you can look at this one as a sample. I tried to give you some wording in there. Some students like to do this as a chart where they have goals in one column, methods, and then materials in the third column, and that's fine. I'm really not that particular about the formatting as long as the content is there. So treatment procedures, I would like for you to start each session with a session overview explaining the content area, what they're working on. For the pediatric clients, I like to kind of list out, if they're readers, you can list out everything they have to get through for the session to earn their prize or their sticker at the end. Same thing for adults, just kind of what the goal for the session is and the activities, what they will be. If they're non-readers, if they're little ones, you can do a picture that kind of represents the things, the activities that will be completed. If they're face-to-face, this can be on a dry erase board, it can be printed out on a piece of paper. If it's a teletherapy client, you can use a PowerPoint slide like this, and the first one can say session overview and have the things that you need to get done. You can even refer back to it during the session with your pediatric clients and kind of check off each one as they get done. So next you're going to teach the objectives or review the objectives, and then the third step is to drill and assess the objectives. So a lot of beginning clinicians, they've got their materials ready and they go straight to drilling. But if you think about it, we chose these objectives because these are areas of deficit for the client, so we don't want to go into quizzing them on these areas because we know they're difficult. We want to first start off by teaching, providing strategies so that they're successful with the activity. Then you'll provide reinforcement for the correct trials, and you can vary your verbal praise. Make sure you're not saying good job every single time. You can say, I love how you're working, or that one sounded great. Then you'll provide error strategies for the incorrect trials. That's your skilled intervention, how you're responding when they provide the wrong answer. I want you to maximize your responses. So you want to try to get as many responses from your clients within a session. And then at the end, you're going to wrap up and review. So review what was covered, go over any carryover assignments that you want to provide to the client or to the client's caregiver. Therapy feedback. If you are providing teletherapy, I ask that you stay on your Zoom meeting just for a minute or two after the client leaves the room so that I can give you direct, immediate feedback after the session. If you're a face-to-face client, I will, or if you have a face-to-face client, I will give you either written or verbal feedback directly after your session. Typhon is the website that we use for tracking your clinical hours. Ms. Cole, if she hasn't already, she will give you instructions for purchasing and setting up your Typhon account. You're going to be sure to enter your Typhon hours on a weekly basis, and I go in several times throughout the semester to approve those hours. So let me know in the beginning if you have any questions about your client's diagnosis or any of the options in there. Just let me know at the beginning of the semester and I'll help you through that. This slide is for if you are providing teletherapy services, but again, I will send out a Zoom link for the therapy sessions. For the pediatric clients, you're going to want to ask a caregiver to stay next to them for the whole session to help them navigate the computer or behavior things and attention. You will log into Zoom and wait for the supervisor to begin the session, so try to get on there about at least 3, 4, or 5 minutes ahead of the session. Have all your materials pulled up at the beginning so you're not fumbling through and you can transition between activities quickly. Be sure your client's face is correctly positioned to the camera, especially for your ARTIC clients. Make sure you can see their mouth, and you might need to get them to come closer to the camera. Posture, sitting up in a booster seat. If there's a big bright window behind them, sometimes you can't see. So just trying to take care of any of those issues in the beginning. Visual organizers, we talked about that, letting them know what they have to get through for the session. There's lots of interactive games and dice and spinners, and I have another video that I'll send you that goes over a lot of the actual teletherapy materials. The next video that I send will go over all of the teletherapy, how to use Zoom, and some tips for different activities. And that's all I have for today. Thank you for hanging in there through this video, and I look forward to working with you all soon.